And Shawn, so let's talk about post-op. I mean, what do you tell the patient what to expect?
Sure.
What medication do you give them and what to expect?
Obviously we check their urine in the office, and we make sure there's not an infection. I give them preoperative, IV antibiotics before the procedure, skip protocol type stuff. I'll send them home on tramadol. I typically don't send patients home on antibiotics. There's not any literature that supports that. I know in some of these chats about UroLift, they talk about, well, I send them home with 3 days of Levaquin. I want to prevent an infection. There's no data that supports putting patients on antibiotics after a UroLift. So I do send them home with some tramadol. And, I have the discussion about just like any procedure. And I do this right before they go back. Remember, any kind of surgery, you are going to have some irritation. No one has had any surgery where they feel better immediately afterwards. And so that first week, some frequency, urgency, you're going to see blood in the urine. You're going to have some irritation when you urinate, but that will get better typically within the first week. So again, reiterating those expectations. And, the other thing that does is that minimizes the calls. That minimizes the calls to the on-call doctor, to the nurse that you're having to return, because people think something's wrong because you've discussed with them a minimally invasive option that's going to help your symptoms. If you don't spend a little bit of time to tell them that first week may not be great, then they're going to think something's wrong, right? They're going to think that you did something wrong, that I shouldn't be feeling like this. So having those discussions, right before we put them to sleep with the family there, that, hey, this is what to expect, and this is normal. Give them the tramadol, and I try to avoid narcotics because, obviously we don't want to do anything that's going to quiet the bladder too much. That's what I do from a post-operative standpoint.
Yeah, so I usually, for a TURP in general, I do pyridium, antibiotics, just prophylaxis, the ibuprofen 800 or meloxicam, I tend to alternate, and a stool softener. And for UroLift, I do a little bit of combination of those, and also do gabapentin for 3 days. That seemed to help a little bit in those initial days. I started doing BNO and enemas right during the procedure because I was in the OR, and just to see, because you tell me the biggest complaint right there in post-op is that pressure.
Yep.
So I wanted to see, I tried, sometimes it worked, sometimes it didn't, so I stopped doing it. But it would be interesting to see if those BNO enemas really help, because they tend to help with bladder spasm in general. So
it's kind of interesting. I know, this is something kind of off the cuff, and there's no literature behind this at all because I looked it up. But I've had 2 patients, and it's interestingly in the last 2 months, they had some Valium, and they took a low-dose Valium the first day or 2 following the surgery, and they said that it was amazing. It relaxed them, helped with any kind of spasms and some of the irritation from urination. I haven't adopted that, or I'm not sure if I want to get into that, but I've had 2 patients, individual of each other that had Valium as needed, not from me, just from someone else, and said they took that and that it made a big difference. So I'm not sure if you've ever, had any experience with that.
I try not, I use Valium only for the vasectomies, but
right.
Yeah, it's not a medication that we in residency we use, so it's difficult for me to add new medication, opioids,
Sure.
narcotics, things like that, the present. So who knows? But yeah, maybe it works. The problem, I guess, if the guy's sleeping better with the Valium, then what was it? Because that nocturia symptoms, it's never just the prostate; it's a combination of stuff.
Right. Absolutely.
So yeah, so who knows? And then they want more.
Sure.
That would be my only concern.
Then you're stuck. That's right.
So Shawn, I think we covered a lot of bases here today. Anything else you like to add?
No, I typically will see them in the office, my UroLifts, or, even a green light. I'll see them in a month. I think, if you see a patient at that 2-week mark, now if they're in retention and you need to watch them a little closer to make sure they're voiding, that's one thing. But I'll see them at 1 month. And typically at that point in time, I'm kind of coaching them through. At that point in time, typically the inflammation has improved. A lot of the real bothersome symptoms have resolved. But obviously the frequency, the urgency, some of those symptoms may persist. And kind of coaching them that, hey, that can sometimes take up to 3 months. I know in the TURP literature, they talk about 3 months as the window of allowing the bladder to readjust, and kind of talking them through that mark. And then I'll see them at 3 months, and I'll do an IPSS score at that time. And that's really when I can compare, hey, here's where you were and here's where you are now. And hopefully they have the outcome that they expected.
Teleflex is the paid commercial sponsor of this podcast and is not responsible for the content beyond this paid acknowledgement. The UroLift system is indicated for the treatment of symptoms of an enlarged prostate up to 100 cc in men 45 years or older. As with any medical procedure, individual results may vary. Most common side effects are temporary and include hematuria, dysuria, micturition urgency, pelvic pain, and urge incontinence. Rare side effects, including bleeding and infection, may lead to a serious outcome and may require intervention. Consult the instructions for use for a complete listing of indications, contraindications, warnings, precautions, and potential adverse events.